Hello, welcome to the back safety presentation. My name is Pamela Kevitch, and I'm the Senior Health Promotion Specialist at SummaCare, and I will be your host. This presentation will focus on common back pain, how it affects everyday life, and the causes and common issues. We will discover the factors that increase the risk for developing back pain and issues, and learn lifestyle behaviors and techniques to improve or even prevent back pain and their related issues. Here are the 8 dimensions of wellness. While all dimensions of wellness need our attention, there doesn't have to be balance among all of the dimensions. Instead, the goal is to find harmony with the dimensions that are most authentic for you in the moment. This presentation will focus on the physical domain by adopting healthy habits and avoiding or minimizing risky behaviors. Let's start with statistics. Experts estimate that 80% of Americans will experience some form of back pain during their life. 95% of those suffering will recover within a few months, with 5% developing chronic low back pain. It is the 3rd most common reason for doctor visits. Though back pain is common across all age groups, those between 45 and 64 years old are most likely to suffer. Women are also more likely to report suffering from back pain when compared to men. However, women, 20%, are less likely to report that low back pain affects their ability to do their work, as opposed to men at 31%. About 40 million employees, more than a quarter of American workforce, have chronic lower back pain, causing 364 million lost workdays annually, which equates to 2 workdays for every full-time worker. Being the most common reason for missed work, the U.S. Bureau of Labor Statistics has confirmed that workers take an average of 12 sick days to recuperate before going back to work. The cost of back pain in the U.S. economy is estimated to be between $560 and $635 billion each year. Most cases are mechanical, meaning not caused by a serious medical condition. 54% of Americans who experience pain spend most of their day at work sitting. And back-related injuries account for 1 in every 5 injuries or illnesses at work. And 80% of these injuries were to the lower back, with 75% of these injuries happening during lifting tasks. The nursing profession is the profession that experiences the most back problems. Let's review the spine. Your spine is made up of 24 bones or vertebrae that are stacked on top of one another. These bones connect to create a canal that protects the spinal cord. The spine contains 4 vertebral segments: 7 cervical, neck; 12 thoracic, chest; 5 lumbar, back; and 5 sacral vertebrae, known as your tailbone. The spaces between the vertebrae are maintained by round, rubbery pads called vertebral discs that act like shock absorbers to cushion the bones as the body moves. 31 pairs of nerves are rooted to the spinal cord, and they control body movements and transmit signals from the body to the brain. The lower end of the spinal column between the sacral vertebrae and the thoracic vertebrae is known as a lumbar spine. These 5 robust, movable vertebrae, L1 through L5, help to sustain the upper body. Because they are larger than other spinal column sections, they can absorb pressures from the head, neck, and trunk. Let's review soft tissues. Various tendons, muscles, and ligaments hold up and support your spine. You need all of them to move properly, and they are all prone to overstretching, twisting, and tearing, which may cause damage and injury. Let's start by breaking down the difference between ligaments, tendons, and muscles, as these body parts are commonly confused. First, muscles are bundles of stretchy, fibrous tissue that allow your body to move and maintain different positions. They are connected to your bones and joints by tendons. Tendons are cords of sturdy, tough, fibrous tissue attaching your muscles to your bones. They are strong, yet still flexible, and your muscles couldn't move your bones or joints without them. Ligaments are slightly elastic fibrous tissue that connects two or more bones together. They help stabilize your joints while you are standing, sitting still, and while you are moving. They help prevent excessive movement injuries such as hyperflexion, which is bending backward, and hyperflexion, which is bending forward. Your spinal ligaments help protect your vertebrae, keep them in their proper position, and help you stay upright. Since the ligaments are slightly elastic, you can potentially overstretch them through sudden or extreme movements, and you can even tear them. It's no surprise that the anatomy of your back is very complex, and you rely on it for many different things. Since muscles, ligaments, and tendons are constantly working to hold your body upright, you are prone to injuries such as tearing, pulling, and overstretching. It's important to understand that muscles and tendons get strained, ligaments get sprained. These are both considered soft tissue injuries, and people often use them interchangeably, but they're actually different. There are many underlying causes of muscle pulls, tears, and strains. In your back, these injuries are more likely to occur in the lumbar region of your spine, as this area endures quite a lot of tension, weight, and twisting. The symptoms of a torn muscle may vary from individual to individual, and the severity of your pain may be a result of the cause of your pulled back, your age, or other condition you may currently have. The most common symptoms of a torn, strained, and pulled muscle may include sore spot or tenderness in your lower back, pain that occurs suddenly, muscle spasms, pain that increases when standing, walking, or twisting, stiffness in the back region, pain that radiates to your legs, buttock, or thigh areas, and last, weakness in your muscles and tendons. It's important to note that some of the symptoms listed are similar to many other back conditions. To ensure if you have a pulled or strained muscle, have an evaluation by a healthcare provider to be certain. Next, we will review common skeletal irregularities. First, when viewed from the front, scoliosis presents as a sideways curvature of the spine, most often in the thoracic portion. Its symptoms often begin in adolescence and become more pronounced toward the end of puberty into adulthood. The curvature can rank anywhere from mild to very severe. Mild scoliosis may lead to muscular imbalances, mobility issues, and mild back pain, while severe scoliosis can lead to difficulty breathing, damage to the organs in and around the rib cage, especially the heart and lungs, and greater risk to injury due to shearing forces applied to the spine. Scoliosis is not the excessive curvature of the spine's natural curves. It is typically caused by injury, disease or infections, muscular weakness, or imbalance. In other rare cases, it may be the result of a neuromuscular disorder, birth defects, or severe injury to the spine and surrounding tissue. Another form that typically occurs with old age is degenerative scoliosis, which occurs because of the atrophy of musculature or loss of muscle tone and strength around the spine. Next, kyphosis is a spinal disorder, which can look like a person has a humpback or hunchback. Kyphotic curves are more common in the thoracic spine, but can also be cervical. The condition can be due to poor posture or a structural abnormality in the intervertebral discs, muscles, bones, nerves, and ligaments. Severe curvatures can affect lungs and other organs. Kyphosis results in a pitched forward head rather than being aligned with the pelvis to allow for the correct distribution of mechanical stress during movement. Last, lordosis is the normal inward curvature of the spine in the lumbar region. Lordosis can become exaggerated, leading to a condition called hyperlordosis. This condition is also known as sway back or anterior pelvic tilt. Oftentimes, the term lordosis and hyperlordosis are used interchangeably. Hyperlordosis can cause pain and discomfort, as well as interfere with movement and balance. What causes excessive lordosis? Poor posture, slouching, or standing with poor posture. Muscle imbalances. If the muscles in the front of the body, such as the hip flexors, are stronger than the muscles in the back, this causes an imbalance. Obesity. Excess weight can put additional strain on the lower back. And last, pregnancy. The weight of the baby causes changes in the body's center of gravity during pregnancy. It is estimated that up to 50% of the population may have some degree of lordosis. Hyperlordosis is more common in women than in men, and especially more common in people who are overweight or obese. It is also more common in people who have occupations that require prolonged standing or heavy lifting. Next, we will review common degenerative issues. First, spondylosis is an age-related condition affecting the joints and cartilage-lined discs found within the neck. Most present no symptoms. Those who do have symptoms have slight pain around the shoulder blade and or pain along the arm and in the fingers. Diagnosis is based on symptoms expressed and imaging tests to confirm the condition. Next, spinal stenosis happens when the space inside the vertebrae is too small. This can put pressure on the spinal cord and nerves that travel through the spine. Spinal stenosis occurs most often in the lower back and the neck. Spinal stenosis in the lower back can cause pain or cramping in one or both legs, and this happens when you stand for a long time or when you walk. Symptoms may get better when you bend forward or sit. I must note that some people with spinal stenosis have no symptoms. While some people are born with a small spinal canal, most spinal stenosis occurs when something happens to reduce the amount of open space within the spine. Causes of spinal stenosis include the following: bone spurs, herniated discs, thick ligaments, rarely tumors, and spinal injuries. Next, disc degeneration typically develops in the parts of your spine that move the most, your lower back or your neck. About 90% of disc problems caused by degenerative disc disease happen in the lowest portions of your lumbar spine. Your spinal discs are made up of a soft inner core and a tough outer wall, and the discs change in ways that may cause degenerative disc disease. Drying out. As you age, they lose water and get thinner. Cracking. Stress and strain on your back can cause tiny tears in the outer wall of your discs, which contain the nerves. Daily activities. Wear and tear on your back from the things that you do every day, like heavy lifting, such as a laundry basket, picking up a crying child, and working in the garden, can contribute to disc degeneration over time. And last, injuries. Even minor injuries to your back from a fall, for example, or lifting something heavy incorrectly, make disc degeneration more likely. Common signs include pain that feels worse when you sit and better when you move and walk, Feels worse when you bend, lift, or twist. Gets better when you change positions or lie down. In some cases, degenerative disc disease can lead to numbness and tingling in your arms and legs and cause your leg muscles to become weak. Next, we'll highlight herniated disc, sciatica, and osteoarthritis. Most commonly known as the herniated disc. A disc begins to herniate when its jelly-like nucleus pushes against its outer ring due to wear and tear or a sudden injury. This pressure against the outer ring may cause low back pain, putting pressure on nearby nerve roots. Not only is this a compression or squeezing of the nerves, but the disc material also releases chemical irritants that contribute to nerve inflammation. Around 90% of all herniated discs occur in the lumbar spine area. This usually occurs at L4 and L5 and the L5-S1 region of the spine. A herniated disc is most often the result of natural age-related wear and tear on the spine. As people age, the water content in the discs decreases and the discs become less flexible. They begin to shrink and the spaces between the vertebrae get narrower. This normal aging process makes the discs more prone to herniation. A traumatic event such as a fall can also cause a herniated disc. Certain factors may increase your risk of a herniated disc. These include the following. Gender. Men between the ages of 20 and 50 are most likely to be at risk. Improper lifting. Using your back muscles instead of your legs to lift heavy objects can cause a herniated disc. Twisting while you lift can also make your back vulnerable. Weight. Being overweight puts added stress on the discs in your lower back. Repetitive activities that strain your spine. Many jobs are physically demanding. Some require constant lifting, pulling, bending, or twisting. Using safe lifting and movement techniques can help protect your back. Frequent driving. Staying seated for long periods, plus the vibration from the car engine could put pressure on your spine and discs. Sedentary lifestyle. Regular exercise is important for prevention. Smoking. It is believed that smoking lessens the oxygen supply to the disc and causes more rapid degeneration. Luckily, herniated discs usually heal on their own. It's recommended to use conservative methods of treatments to help ease your pain and lower the chances of your condition worsening. Sciatica. When a nerve root is irritated, there may be pain, numbness, and weakness in one or both of your legs, a condition called sciatica. Typically recognized as a sharp, often shooting pain that extends from the buttock down the back of one leg, it is caused by pressure on the sciatic nerve. Sciatica frequently results from a herniated disc in the lower back. Usually one side is affected. The pain is described again as sharp and electric-like shock. It may be more severe with standing, walking, or sitting. Straightening the leg on the affected side can often make the pain worse. Along with leg pain, one may experience low back pain. However, for acute sciatica pain in the leg is often worse than the pain in the lower back. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It occurs when the protective cartilage that cushions the ends of the bones gradually deteriorates. Cartilage is a firm, slippery tissue that enables nearly frictionless joint motion. If the cartilage wears down completely, bone will rub on bone. Osteoarthritis has often been referred to as the wear and tear condition. The condition most commonly affects joints in your hands, knees, hips, and spine. Osteoarthritis symptoms can usually be managed, although the damage to joints can't be reversed. Staying active, maintaining a healthy weight, and receiving certain treatments might slow the progression of the condition and help improve pain and joint function. Osteoarthritis symptoms often develop slowly and worsen over time. Signs and symptoms include the following: pain. Affected joints might hurt during or after movement. Stiffness. Joint stiffness might be most noticeable upon awakening in the morning or after a nap or after being inactive for a long period of time. Tenderness. Your joint might feel tender when you apply pressure to or near it. Loss of flexibility. You might not be able to move your joint through its full range of motion. Grating sensation. You might feel a grating sensation when you use the joint, and you might hear popping or crackling. Bone spurs. These extra bits of bone, which feel like hard lumps, can form around the affected joint. And swelling is often caused by soft tissue inflammation around the joint. Factors that increase your risk for osteoarthritis include older age. The risk of osteoarthritis increases with age. Gender. Women are more likely to develop osteoarthritis, though it isn't clear why. Obesity. Carrying extra body weight contributes to osteoarthritis. Increased weight adds stress to weight-bearing joints, such as your hips and knees. Joint injuries. Injuries, such as those that occur when playing sports or from an accident, can increase the risk for osteoarthritis. Even injuries that occurred many years ago and seemingly healed can increase the risk. Repeated stress on the joint. If your job or a sport you play places repetitive stress on a joint, that joint might eventually develop osteoarthritis. Genetics. Some people inherit a tendency to develop osteoarthritis. Bone deformities. Some people are born with malformed joints and defective cartilage. And last, certain metabolic conditions. These include diabetes and a condition in which your body has too much iron, known as hemochromatosis. When should you contact a healthcare provider? Most back pain gradually improves with home treatment and self-care, usually within a few weeks. Contact a healthcare provider for back pain that lasts longer than a few weeks, is severe and doesn't improve with rest, spreads down one or both legs, especially if the pain goes below the knee, causes weakness, numbness, or tingling in one or both legs, and is paired with unexplained weight loss. In rare cases, back pain can signal a serious medical problem. Seek immediate care for back pain that causes new bowel or bladder problems, is accompanied by a fever, follows a fall, blow to the back, or any other type of injury. It is osteoporosis. Bones are made of living tissue. A healthy human body breaks down old bone and replaces it with new bone. With osteoporosis, more bone is broken down than replaced, causing the inside of the bone to look like a honeycomb. Osteoporosis causes the walls of the honeycomb to get smaller and the spaces between the bone to get larger. The outer shell of the bone also thins, making the bones weaker. People with osteoporosis have a harder time recovering from broken bones, which can sometimes cause constant pain, and broken hip and spine bones are especially serious, as these injuries may cause older adults to lose their mobility and independence. Next, let's review the common risk factors for osteoporosis. Older than 60 years of age, have broken a bone before age 50, You notice that you are losing your height or getting shorter. You have a parental history. You have low testosterone levels. You have experienced early menopause. Your periods have stopped. You have had your ovaries removed. You are diabetic. You are going through glucocorticoid treatments. You have rheumatoid arthritis. You have a hyperthyroid or hyperparathyroid. You have a digestive disease. And you've had either breast or prostate cancer therapy. Additional osteoporosis risk factors include those persons who have a low body weight, smokers, those that have an intake of excessive alcohol consumption, low dietary calcium intake, late puberty, history of eating disorders, generally physically inactive, and high caffeine intake. Let's talk about prevention. If you're under 30, you're still adding calcium to your bones. So the best way to prevent osteoporosis is to start thinking about it now. Here are the top things you can do to prevent osteoporosis. Stop smoking or vaping. Quitting nicotine reduces your risk. Avoid excessive alcohol. If you do consume alcohol, limit drinks to 2 to 3 drinks per day at most. Get enough calcium. Ensure that you have an adequate intake of calcium in your diet. Good dietary sources of calcium include dairy products such as milk, yogurt, and cheese, leafy green vegetables such as kale and broccoli, and calcium-fortified foods. Maintain a healthy body weight. Being underweight can increase the risk, so it's important to maintain a healthy body weight throughout a balanced diet and regular exercise. Get enough vitamin D. You can get vitamin D from sunlight exposure, dietary sources such as fatty fish and fortified foods, and supplements if necessary. In the winter months especially, vitamin D levels go down from less exposure to the sun. Your healthcare provider can screen for low levels of vitamin D through routine blood work. And last but not least, stay physically active. Include weight-bearing exercises into your routine. This can be walking, jogging, or strength training. Aim for at least 150 minutes of moderate intensity exercise each week. Osteoporosis is a treatable disease that may even be preventable with early intervention and lifestyle changes to prevent the bone loss and fractures. Therefore, it is imperative to start thinking about your bone health when you're young. The bone bank of the skeleton is like an annuity program. You need to put calcium in when you're young to be able to withdraw it as you get older with minimal consequences. Bone density testing is the best way to diagnose osteoporosis and assess bone health. This test measures the density of your bones, typically at the hip and spine. The most commonly used test is a dual energy X-ray absorptiometry, known as the DEXA scan. Radiation levels are extremely minimal, so you don't have to worry about radiation exposure. Everyone should request a DEXA scan from the healthcare provider if they're over 50 or if they have a family history of osteoporosis. It serves as a baseline for comparison as you age over time. In many cases, health insurance plans, including Medicare, will cover DEXA scans for the diagnosis and monitoring of osteoporosis. However, coverage can vary depending on your insurance provider, the specific plan you have, and your risk factors. Standard X-rays are not typically used as the primary method to diagnose osteoporosis because they do not provide a direct measurement of bone density. Instead, X-rays are more useful for identifying fractures or complications related to osteoporosis. Note, a person can have normal blood calcium levels, but still be at risk for osteoporosis. Why? Blood calcium levels are tightly regulated by the body, and the body maintains a stable calcium concentration in the blood by using calcium from the bones when necessary. So even if your blood calcium levels are within normal range in your lab work, which is just a snapshot of your calcium, your bones can still be losing calcium and becoming less dense, which may lead to osteoporosis. So how is it treated? Although getting enough calcium and vitamin D can help prevent further bone loss, lifestyle changes, including proper diet and weight-bearing exercises, can help increase bone mass. As far as clinical treatment for osteoporosis, estrogen is an option for postmenopausal women to help slow bone loss and increase the body's calcium stores. It is important to remember that this hormone does not come without possible side effects. There are many medications out there which are capable of slowing bone loss and increasing density of bone. You should discuss with your healthcare provider which option may be right for you. Anyone can develop back pain, even children and teens. These factors can increase the risk of developing back pain. Age. Back pain is more common with age, starting around the age of 30 or 40. Lack of exercise, weak or unused muscles in the back and abdomen may lead to back pain. Excess weight. Excess weight puts excess stress on the back. Conditions. Some types of arthritis and cancer can contribute to back pain. Improper lifting, using the back instead of the legs, can lead to back pain. Psychological conditions. People prone to depression and anxiety appear to have a greater risk of back pain, and stress can cause muscle tension, which can also contribute to back pain. And last, smoking. Smokers have increased rates of back pain, which may be due to smoker's cough, which could lead to herniated discs. Having a sedentary lifestyle is often a main contributor to back pain. Why? Because it causes decreased muscular strength and endurance, which makes you more susceptible to strains and sprains, and it increases the risk for injuries after a prolonged period of time. Also causes decreased bone density. Therefore, you would be more susceptible to fractures and down the road, osteoporosis. Often related to poor posture and increases risks for heart disease, cancer, and diabetes. So how do you reduce pain with regular exercise? Well, the regular exercise will help to improve muscular strength by building strength in all of your back muscles, improve muscular endurance, which will allow you to move and work longer, increases core strength, in turn strengthening those lower back muscles, increases balance, lowering the risk of falls, improves squat and lift function, increases bone mineral content and strength, and ultimately reduces weight. Overweight impacts. Extra weight in the stomach area will pull the pelvis forward and cause strain due to increased load on the lower back. Herniated discs from too much pressure on the spine, which can lead to bulging, ruptured discs, as well as sciatica. Extra weight around the spine can cause pinched nerves. And those with a body mass index or a BMI greater than 25 are more likely to develop osteoarthritis. Smoking reduces the blood supply to the bones and many other body tissues. The nicotine in tobacco products slows production of bone-producing cells called osteoblasts. Smoking decreases the body's absorption of calcium, which is necessary for vital cellular functions and bone health. Smoking affects the balance of hormones, including estrogen, which is needed to build and maintain strong skeletons in both women and men. Can back pain be prevented? The answer is yes. Reoccurring back pain resulting from improper body mechanics may be prevented or avoided by avoiding movements that jolt or strain the back, by maintaining correct posture, and lifting objects properly. Many work-related injuries are caused or aggravated by heavy lifting, contact stress, vibration, repetitive motion, and awkward posture. Here are some recommendations for keeping one's back healthy. Exercise regularly to keep muscles strong and flexible. Consult your healthcare provider for low-impact, age-appropriate exercises that are specifically targeted to strengthening the lower back and abdominal muscles. Maintain a healthy weight and eat a nutritious diet that includes a sufficient intake daily of calcium, phosphorus, and vitamin D to promote new bone growth. Use ergonomically designed furniture and equipment at home and at work. Make sure work surfaces are well organized and at a comfortable height. Avoid prolonged sitting and stay active. Switch sitting positions often and periodically walk around the office or gently stretch muscles to relieve tension. A pillow or rolled up towel placed behind the small of the back can provide some lumbar support. Put your feet on a low stool or a stack of books when sitting for a long time. Wear comfortable, low-heeled shoes. Sleeping on one side with the knees drawn up in a fetal position can help open up the joints in the spine and relieve pressure by reducing the curvature of the spine. Consider sleeping on a mattress of firm to medium firmness, as it gives good support to the spine. Ultimately, you should be comfortable. Do not try to lift objects that are too heavy. Lift from the knees, pull the stomach muscles in, and keep the head down and in line with a straight back, keeping objects close to the body. Do not twist when lifting. And last, quit smoking. Smoking reduces blood flow to the lower spine, which can contribute to spinal disc degeneration. Smoking also increases the risk of osteoporosis and impedes healing. Let's review proper lifting technique. Improper lifting techniques commonly cause back pain and various injuries. Understanding and applying proper lifting techniques is beneficial and essential for long-term health and well-being. First, plan your lift and test the load. If needed, ask for help. Get a firm footing. Bend your knees, tighten your stomach muscles, and lift with your legs, keeping the load close and keeping your back upright. When it comes to lifting heavy objects, people encounter several common problems. These problems can lead to injuries or strains if not addressed properly. Here are some common lifting problems and techniques to help you overcome them. Lifting with your back. This is a common mistake where individuals rely primarily on their back muscles when lifting an object. This puts undue stress on the spine, leading to muscle strains and injuries. Lifting with your legs and hips is crucial. The legs and hips are stronger and better equipped for handling heavy loads while keeping the back straight. Bending forward and keeping your legs straight to pick an item up. When you bend over to lift something without bending your knees, you are placing all the strain on your back and hamstring muscles. This can easily lead to pulled muscles or damaged ligaments. Instead, you should bend your knees and lower your body to the object, keeping your back straight. Twisting while lifting or carrying a heavy item. Twisting your upper body while lifting or carrying a load puts immense pressure on the spine and surrounding muscles and can cause serious injury. Keeping your shoulders and hips aligned and moving your whole body in the direction you wish to go rather than twisting at the waist is important. Lifting a heavy item above shoulder height. Reaching for and lifting an object above shoulder height can be dangerous as it compromises your center of gravity and strains your shoulders, neck, and upper back. Use a stool or ladder to get closer to the object and lift it close to your body. Carrying an item that's too heavy or large. Sometimes individuals underestimate the weight or size of an object and attempt to carry it despite it being too heavy or cumbersome. This overexertion can cause muscle strains or falls. It's crucial to assess the weight and size of the object and seek assistance or use lifting aids if needed. Using a partial grip, 2 fingers. Lifting heavy objects with an inadequate grip, such as only a couple of fingers, places excessive strain on certain muscles and joints and increases the likelihood of dropping the object. Ensure a full, firm grip, and if the object is too large or awkward, use lifting straps or ask for help. Lifting items when you're tired, fatigued, or already injured. Your muscles do not perform at their best when your body is tired or injured. Lifting heavy objects in this state can easily result in further injuries. It's important to recognize when your body needs rest or when an injury requires attention, and avoid heavy lifting during these times. Holding your breath. Holding your breath while lifting can cause a dangerous increase in blood pressure and deprive muscles of oxygen needed during exertion. Breathing regularly throughout the lifting process is important, generally exhaling on the effort and inhaling as you release. Try to lift and move the item too quickly. Rushing through lifting and carrying heavy objects is a recipe for accidents and injuries. It's important to move deliberately and carefully, paying attention to your form and the environment around you to ensure safety. Proper lifting zones. The power zone principle is to maintain a neutral posture. The power zone for lifting is close to the body between mid-thigh and mid-chest height. This zone is where the arms and back can lift the most with the least amount of effort. Called the handshake zone or comfort zone, the principle here is that if you can shake hands with your work, you are minimizing excessive reach and maintaining a neutral posture. Working from the power, comfort, handshake zone ensures that you are working from proper heights and reaches, which reduces risk factors and allows for more efficient, pain-free work. Take-home message. Remember, it's usually the minor everyday movements performed incorrectly that cause injury. Keep your back, core, and body healthy and strong. Exercise regularly, eat healthy, and be active. Lose weight if needed. Stop smoking if needed. And ask for assistance to lift an object if needed. And last but not least, use the correct neutral posture to lift an object. SummaCare resources. We definitely encourage an annual visit with your primary care provider. We offer condition and care management programs for those that may be diagnosed with a chronic condition or have complex needs. We also offer access to diabetic testing supplies. We offer a telephonic health coaching program for lifestyle behavior management. You have access to WebMD Health Manager through SummaCare's Plan Central. We do offer a 24-hour nurse line and have SummaCare nurses available 24/7, 365 for any of your medical needs and questions. You do have a telemedicine feature through Teladoc Health. So while traveling or in urgent need of a minor medical issue of concern, you can be connected to a healthcare provider. We do offer Quick Care, our telephonic smoking cessation coaching program, and it is also supported with limited nicotine replacement therapy. And last but not least, we do offer Husk Health and Wellness discounts, where you have access to discounted health club memberships, nutrition programs, and educational resources. Thank you for listening to the back safety presentation. Here are the resources that were used to create this presentation for you. And last but not least, follow SummaCare on any of the listed below social media platforms. Thank you and be well.